Some developments today in the fight against COVID-19. The FDA voted to approve Pfizer's booster doses for healthy kids between the ages of 5 and 11.
The CDC still needs to give final approval, but that could come later this week.
The news comes as 7 Wisconsin counties have high COVID-19 community spread. Dane County is at the medium level, so there is lots to talk about today with UW Health Chief Quality Officer Dr. Jeff Pothof. Dr. Pothof, good to see you.
Good to see both of you.
So let's talk about boosters for kids first of all. Are boosters necessary for children?
You know, I think it's a really good idea. So that booster dose does give you some added protection against severe disease. And kids don't get severe disease as often as adults, but kids do get severe disease. And with the risk being so low with these boosters, they're really well tolerated. It's kind of a no-brainer. Likewise, it's nice to not have our kids sick. It's summertime, they're trying to play soccer, be outside. You know, why have them get sick? Why have them have long-haul symptoms? I think just get the booster and then move on with it.
And is this an important tool in the toolbox to help us all collectively try to, get through this phase of the pandemic?
Yeah, I think, what we're really trying to do is, I think we understand with these really contagious subvariants that a lot of people, even if you're boosted, if you've had COVID before, you're likely to get some symptoms, but you really want to avoid getting severe disease. And these booster shots do allow for that. They reduce the risk of severe disease. They even give you some protection against getting any symptoms at all. And that's really us doing our part to try to keep hospitals safe so that can stay open for other patients and not just the COVID patients. I think it's just a good idea.
Is it a full Pfizer dose for children, or is it a half a dose?
The Pfizer dose is a reduced dose for the 5 to 11-year-olds.
Okay. A lot of parents have been waiting for this for a long time. Other parents are very nervous about getting their children vaccinated. What is your advice for parents that are weighing the options?
Yeah, I think for those that were nervous, there's a whole bunch of data now. We've immunized a whole host of kids in this 5 to 11 age group, and the side effect profile is great. We don't see bad things happening to kids who are getting immunized. We can't say the same thing for kids who are getting COVID. Most of them do okay, but some of them don't, or they have long-haul symptoms or other things that are undesirable even if they don't die of the disease. So at this point, with all the data that we have, I think it's really a good decision to go out and get those kids vaccinated. It should put most parents' mind at ease.
And if they do have questions, would you recommend they talk with their primary physician?
Absolutely. Talk to their pediatrician, say, hey, I've got questions, I'm not sure, should I do this? I think they'd be well guided by talking to their physician.
We showed the map earlier about COVID spread in the state, and Dane County is at the medium level. Can you tell us what that means, and do you think we're going to be restarting the mask discussion once again?
Good question. So the CDC community level has this green, yellow, red map. At green, what that means is that cases are low enough, hospitals are doing well enough where we don't have to worry a whole lot. We can, be maskless, we can gather in groups, and that's where we were for a good number of weeks. In the yellow category, this looks at both total number of cases as well as capacity in that county's health systems to handle more cases. And at the yellow level, cases are up enough where the majority of us don't have to do a whole lot different, but those who would be high risk, immunocompromised and such, they should likely start considering wearing a mask. So that's where we are in Dane County. If we move to the red category, that means cases are so high, hospitals are busy enough where at least for a short period of time, we'd all do well to wear masks in indoor settings where it's crowded to reduce that transmission so we don't get in a situation where healthcare systems start to get overrun by COVID patients such that they can't manage both COVID patients and other patients at the same time.
Do you think that the likelihood of this being just a pattern where we do so well for a little bit, in cases spread again, we kind of go back, is this something that we'll have to keep living with?
I think we could, and I think the frequency by which we go up and down will get longer, which is nice, but as new subvariants develop, they become more contagious, they likely lead to this increase in cases. Thankfully, this time we're not seeing those hospitalization numbers trend up at the same rate, but it could be for a year or two where things kind of go up and down, and maybe for a week or two we put those masks back on when we go inside and we take them back off again. I think that could happen.
Especially as we approach the fall. Right now we're all outside, and we're all going to be heading back indoors. So there'll be a lot to talk to you about, so don't go far.
Right.
Good to see you, Dr. Pothof. Thanks for coming out.